Mental health. 10 important signs of mental illness. Good day, everyone. Welcome back to our channel. It's great to meet again. In this video, we'll dissect mental health in all of its complexities and simplicity. But first, subscribe to our channel and click the notification bell to get notified whenever a new video is uploaded. From time to time, everyone experiences changes in their emotions, thoughts, and behavior. However, if these changes make it difficult for you to function on a daily basis, you may be suffering from a mental disorder. Depression, anxiety disorders, bipolar disorder, and schizophrenia are all examples of mental illness. It's widespread, impacting millions of people each year all across the world. There's no easy way to detect it if you or someone you know is suffering from a mental illness. Small changes in your behavior are often noticed by you or those around you long before the symptoms become significant. Mental disease, often known as mental health problems, encompasses a broad spectrum of disorders that impact your emotions, thoughts, and behavior. Depression, anxiety disorders, schizophrenia, eating disorders, and addictive behaviors are all examples of mental disease. Many people suffer from mental health issues at times. When persistent indications and symptoms create regular stress and impair your ability to function, a mental health condition becomes a mental disease. Mental illness can make you unhappy and cause problems in your daily life, such as at school, work, or in your relationships. Symptoms can usually be controlled with a combination of medicines and talk therapy, psychotherapy. Important signs of mental illness. In terms of mental health, everyone has peaks and valleys. A traumatic event, such as the death of a loved one, may temporarily impair your psychological well-being. In general, your symptoms must cause significant discomfort or interfere with your social, occupational, or educational functioning, and they must endure for a set amount of time to meet the criteria for mental illness. Each condition has its unique set of symptoms, which can range from mild to severe, but frequent indicators of mental illness in adults and adolescents include the following. 1. Sleep or appetite changes, dramatic sleep and appetite changes, or decline in personal care. 2. Mood changes, rapid or dramatic shifts in emotions or depressed feelings. 3. Withdrawal, recent social withdrawal and loss of interest in activities previously enjoyed. 4. Drop in functioning, an unusual drop in functioning at school, work, or social activities, such as quitting sports, failing in school, or difficulty performing familiar tasks. 5. Problems thinking, problems with concentration, memory, or logical thought and speech that are hard to explain. 6. Increased sensitivity, heightened sensitivity to sights, sounds, smells, or touch, avoidance of overstimulating situations. 7. Apathy, loss of initiative or desire to participate in any activity. 8. Feeling disconnected, a vague feeling of being disconnected from oneself or one's surroundings, a sense of unreality. 9. Illogical thinking, unusual or exaggerated beliefs about personal powers to understand meanings or influence events. Illogical or magical thinking, typical of childhood, in an adult. And 10. Nervousness, fear or suspiciousness of others, or a strong nervous feeling. If you're experiencing any of these symptoms, you should get help from a counselor or psychiatrist right away. This can help prevent your sickness from worsening or going untreated. Mental illness can be treated in a variety of ways. The correct combination of therapy, medication, and good habits like mindfulness practice can transform your life. You can have more productivity in your daily life, a better ability to manage stress, and a more positive self-image if you have strong mental health. Types of mental illness. There are hundreds of mental illnesses listed in the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, the American Psychiatric Association's Diagnostic Manual. The DSM-5 puts illnesses into categories based on their diagnostic criteria. Anxiety disorders. This group of mental illnesses is characterized by significant feelings of anxiety or fear, accompanied by physical symptoms such as shortness of breath, rapid heartbeat, and dizziness. The three major anxiety disorders are generalized anxiety disorder, GAD, panic disorder, social anxiety disorder, SAD, bipolar and related disorders. Formerly known as manic depression, bipolar disorders are characterized by alternating episodes of mania, hypomania, and major depression. There are three broad types of bipolar disorder: bipolar 1, bipolar 2, and cyclothymia. Depressive disorders. The common feature of all depressive disorders is the presence of a sad, empty, or irritable mood accompanied by physical symptoms and cognitive changes that significantly affect a person's capacity to function. Examples include major depressive disorder and premenstrual dysphoric disorder, PMDD, disruptive, impulse control, and conduct disorders, a group of psychiatric conditions that involve problems with the self-control of emotions and behaviors. Disorders in this group include intermittent explosive disorder, kleptomania, oppositional defiant disorder, ODD, pyromania. Dissociative disorders. This group of psychiatric syndromes is characterized by an involuntary disconnection between consciousness, memories, emotions, perceptions, and behaviors, even one's own identity or sense of self. Elimination disorders. Children with elimination disorders repeatedly void urine or feces at inappropriate times and in inappropriate places, whether the action is involuntary or not. Feeding and eating disorders. Eating disturbances are characterized by a persistent disturbance of eating patterns that leads to poor physical and psychological health. Three major eating disorders include anorexia nervosa, binge eating disorder, bulimia nervosa. Gender dysphoria, formerly known as gender identity disorder. Gender dysphoria occurs when a person feels extreme discomfort or distress because their gender identity is at odds with the gender they were assigned at birth. Neurocognitive disorders. These disorders are characterized by a decrease in a person's previous level of cognitive function. In addition to Alzheimer's disease, other conditions in this category include Huntington's disease, neurocognitive issues due to HIV infection, traumatic brain injury, TBI, neurodevelopmental disorders. These disorders typically manifest early in development, often before a child enters grade school. They are characterized by impairments of personal, social, academic, or occupational functioning. Examples of neurodevelopmental disorders include attention deficit hyperactivity disorder, ADHD, autism, learning and intellectual disabilities, obsessive-compulsive and related disorders. As the name suggests, these disorders are characterized by the presence of obsessions and/or compulsions. Examples of obsessive-compulsive and related disorders include body dysmorphic disorder, hoarding disorder, and obsessive-compulsive disorder, OCD. Personality disorders. These disorders are characterized by an enduring, inflexible pattern of experience and behavior that causes distress or impairment. There are currently 10 recognized personality disorders: schizophrenia spectrum and other psychotic disorders. These disorders are defined by abnormalities in one or more of the following areas: delusions, disorganized thinking, disorganized or abnormal motor behavior, hallucinations, negative symptoms. What causes mental illness? It is not always possible to pinpoint the exact source of mental diseases. Various hereditary and environmental variables, or a mix of both, could be to blame. Genetic. Mental illness is more common in people who have a blood family who suffers from it. Certain genes that raise the risk of mental disease can be inherited. In those who have genetic predispositions to mental disease, Environmental conditions and other psychological or physical stressors can precipitate mental illness. Environmental exposure before birth. Prenatal exposure to environmental stressors, inflammatory disorders, poisons, alcohol, or narcotics might raise the likelihood of a child developing mental illness later in life. Changes in brain chemistry. Neurotransmitters are substances in the brain that transmit signals to other sections of the brain and to the rest of the body. When these substances' roles are disrupted, the nervous system's normal function is disrupted, resulting in mental illnesses. Life experiences. The stressful life events you've had may play a role in the development of mental illness. Experiencing traumatic events, for example, can lead to PTSD, whereas changing primary caregivers frequently as a child can lead to the development of an attachment disorder. What are the risk factors for mental illness? Well, certain factors may increase your risk of mental illness. Family history of mental illness, previous history of mental illness, intense psychological or physical stress due to stressful situations in life, such as financial problems, loss of a job, death of a loved one, or divorce, traumatic experiences such as sexual assault, war, etc., unpleasant childhood due to bullying, abuse, or neglect, chronic medical conditions, especially diseases that are associated with chronic pain and diseases affecting quality of life, such as rheumatoid arthritis, cancer, fibromyalgia, and more, trauma to the brain, alcoholism, and/or drug abuse. Treatment. The majority of mental illnesses are not curable, but they are certainly treatable. Treatment for mental health illnesses varies a lot based on your diagnosis and the intensity of your symptoms, and the outcomes vary a lot on an individual basis. Medication can help with some mental diseases. Talk therapy works best for other illnesses. For some illnesses, science also supports the use of complementary and alternative therapy. Therapy programs can include a combination of treatment alternatives, and determining what works best for you may need some trial and error. Bottom line, major mental diseases like schizophrenia and bipolar disorder rarely strike out of nowhere. Most often, tiny changes or a feeling that something isn't quite right about a person's thinking, feelings, or behavior are noticed by family, friends, instructors, or the person themselves before an illness manifests in its full form. It might be beneficial to become aware of emerging symptoms or early warning indications and to take action. Early intervention can assist to lessen the severity of a condition. It may even be possible to avoid or delay the onset of a significant mental disorder. One or two of these signs may not be enough to diagnose a mental illness, but they may indicate the need for additional investigation. If a person is having many symptoms at the same time, and the symptoms are interfering with his or her ability to study, work, or relate to others, he or she should visit a physician or mental health expert. Suicidal thoughts or purpose, as well as ideas of harming others, require quick assistance. Well, that's all there is to it, guys. We've reached the end of this video. Which of the mental illness signs would you be on the lookout for to protect your mental health? Would you seek help if you ever experienced a combination of some of these signs? Yes, you should. Please share your thoughts in the comments box. If you enjoyed this video, make sure you drop a like and subscribe. Oh, and turn on post notifications. Now, if you'll excuse me, thank you for watching. I'll see you in the next video.